ischemic stroke is the most prevalent type of stroke that patients experience. And an ischemic stroke is an interruption in the blood flow to the brain, which is serving to provide oxygen and nutrients to the brain. And the longer this interruption in blood flow, the higher chance of damage to the brain. So there's also been a lot of literature out there looking at volumes of patients seen by a caregiver or a facility, and that facilities that see more patients have better outcomes. So we wanted to look at this in the context of stroke in Ontario. We know there's a wide variation in the number of stroke patients admitted to Ontario's acute care hospitals. So we wanted to examine whether this relationship exists here in Ontario. We used routinely collected hospital data that is housed at the Institute for Clinical Evaluative Sciences. So we looked at the number of ischemic stroke patients that were admitted to hospital in Ontario from 2005 to 2012 and determined each of the facilities' average volume over those 7 years and created 3 volume categories with roughly equal number of patients in those categories. So we had low volumes, medium volume, and large volume hospitals that were classified. Patients that are seen at small volume hospitals have 47% higher risk of death within 7 days of their ischemic stroke compared to patients that were cared for in the higher volume hospitals. And at 30 days, that risk of death was 37% higher. We also determined as well that 875 deaths could be avoided if patients that were seen at smaller volume hospitals experienced the same death rate as those that were cared for in the higher volume hospitals, and that came up to be 875 potentially avoidable deaths. We also looked at whether there was sort of a natural break point or a threshold where there was a volume was associated with a lower mortality, and we found that 165 annual ischemic stroke patients per year, all those facilities had mortality rates that were below the provincial average, and this would be helpful for any regionalized planning to consolidate stroke care. Currently, the Ministry of Health and Long-Term Care and the Ontario Stroke Network are working towards having the regionalized approach to stroke care to ensure patients are getting to a stroke center where the expertise is there, and there's an interprofessional team to look after stroke patients, because stroke care is complex, and our results have shown that where you have a higher volume, the results are better. The small volume hospitals have 47% higher risk of death than patients seen in higher volume hospitals.